But I'm delighted to be standing here today with some remarkable people to announce some great news that we're going to carry on this work. We've done an awful lot of work over the years. Of all the things I've been involved in, I've been asked a lot of the questions lately as I'm wrapping up a career here over 30 years, 36 in the Congress. What is the issue or the issues that have given me the greatest sense of satisfaction? Without any hesitation whatsoever, the issues that I've enjoyed the most, I feel as though with a blessing of a remarkable staff over the years, the issues affecting children and families have been the most rewarding without any hesitation whatsoever. Beginning back in the earliest days when I arrived here with Arlen Specter, who in those days, Bob, where I hear, was a Republican senator from Pennsylvania. Maybe there's something about some of the water in Pennsylvania. But he and I formed a children's caucus, and we invited selectively members of the Senate who were specifically on committees that were involved in children's issues. So we had Pat Moynihan, who of course is a great advocate in his own right. Bob Dole was involved in agriculture, but a great advocate of food stamps over the years. Anyway, Bill Bradley from New Jersey was deeply involved in our ad hoc group that we formed. We looked around and we saw that there was a caucus for every imaginable constituency in the country except 1 out of 4 Americans who were children. They didn't have a vote, didn't have political action committees, really were just sort of missing in that equation in this building of having people who would stand up and advocate on their behalf. And we held a bunch of ad hoc hearings all over the country on various subject matters. I remember Bill Bradley and I had a hearing on after-school programs in New York City. We had a hearing on child abuse, and I'll never forget it because there was a new senator from Florida by the name of Paula Hawkins, a Republican who was elected with me in 1980. And she came and spoke at our ad hoc meeting on child abuse and announced that she had been herself the subject of sexual abuse as a child. Now, that may not sound like breaking news in 2010, but 30 years ago, to have a woman United States Senator, when there were so few, get up and talk with great candor about her own childhood was headline news around the country. So without boring you a great deal, my work in these issues involving children and families began literally about the moment I arrived in the Senate. And as I said, over the years, working with Orrin Hatch on child care, developing the first child care program since World War II. My work with Lamar Alexander on premature birth and infant screening. Working with Mike DeWine on better pharmaceuticals for children and related issues, medical devices. Working with Dan Coates and Kit Bond on the Family Medical Leave Act. I'm sure Dan campaigned on that issue this year as he came back to the Senate, but he was my principal sponsor of that legislation, and just countless other efforts on Head Start and the like. So those are the issues. And so as I get prepared to leave in a few weeks of the Senate, I wanted to make sure that, one, we could take the last month or 2 or 3 here and sort of go back and regroup and ask ourselves, what is the status of the American child as we finish the first decade of the 21st century? And not only if we do that and make some assessments on areas where we are, but wouldn't it be good if we could do a couple of things? One, establish a National Commission on Children permanently so that there'd be a place, as we have done in my home state of Connecticut, by the way, with great success over the years, to be able to, on a consistent basis, gather the kind of data and information that would give us a good reading of how our most important assets that we all hear such glowing rhetoric about from every political corner, the condition and the concern about America's children. But also, could we set up some sort of a report card that would not only give you a grade, but also begin to sort of judge that against standards? Where a child ought to be, and how are we doing? And so I'm particularly pleased today that we're going to make an announcement establishing that report card with some wonderful people who are making a difference. First Focus, again, Bruce Lesley is a great, great guy and a great former staff guy as well up here in the Senate. So he understands this institution well and making a difference. And one of my dearest friends, whom I respect so much, Mark Shriver, who's just done a remarkable job with Save the Children, coming together, and they'll be talking about this, but I want to take a few minutes and share with you sort of some conclusions about our hearings, our set of hearings we had on the status of the American child. And then I will introduce my colleague and friend Bob Casey, who I can't tell you how excited I am, because Bob, right from the get-go, I mean, right immediately, without any prodding from anybody at all, has just grabbed on and wanted to be involved in these issues, early childhood education and learning, I've been deeply involved in it, eloquent about it. I can't think of a single setting where we haven't gathered that on his own initiative has brought up this subject matter over and over again. Child care, again, something that I got deeply involved in early on. And Bob, interest in the subject matter, understanding the value of it and how important it is. So I'll turn to my colleague in a few minutes and ask him to share some thoughts on this as well, and then Bruce and Mark as well to share some thoughts on this. And I'll try not to take too long, but I wanted to share my thoughts with you about the conditions that we're in. So at the coming of the end of 30 years, I said earlier, my greatest sense of contribution in many ways, if you can do that, has to be in this cluster area involving children and their families. And some of my staff members, former and present, are in the room today. And if I start mentioning some and not others, I've learned, Bob, I'm sure you have in politics, the people you recognize never remember it. The people you fail to recognize never forget you. So I'm going to stay away from trying to go around the room here and identify people. But I thank all of them who are here and others who have been great advocates over the years. I don't think I'd be the first person to state that the status of the American child and families is of the utmost importance. And I can't think of a single gathering where people don't talk about that issue. Alma Powell, who was one of our witnesses in our first hearing, and the chair of America's Promise Alliance, told our subcommittee, the fate of our Americans' children impacts all of our priorities. And again, I think stating the obvious. It's not though there's a political constituency for forcing children to live on the edge of economic disaster or for allowing our children's health and education standards to slip. Too many of our children live in crisis in our country. And let me just share again. I know a lot of you in this room know this, but it's worth repeating. More than 1 in 5 children in America today lives in poverty. 1 in 4 relies on food stamps in our country. Nearly 1 in 3 is overweight or obese. Fewer than 1/2 of our 4th, 8th, and 12th graders can read or do math at the appropriate grade level. That is in the greatest, wealthiest country in the history of mankind. Just keep that in mind as we talk about these numbers and what's happening. Again, repeating, 1 in 5 living in poverty, 1 in 4 relying on food stamps, 1 in 3 growing up obese with all of the problems that will cause in later years. And, of course, our children in education are not meeting grade levels. One stark report by a bipartisan group of senior retired military leaders found that 3 in 4 of our children are unfit to serve. And let me quote them, because they failed to graduate from high school, have a criminal record, or are physically unfit. 3 out of 4 cannot meet the requirements to serve in the United States military. Marion Wright Edelman, who's been a great pal and friend over 30 years, the head of the Children's Defense Fund and a perpetual witness, and again, a witness in our closing hearings on the status of the American child, said something in our subcommittee that just is so, again, obvious and clear, but deserves being repeated. A country that does not stand for its children stands for nothing. And you couldn't be more stark or clear, in my view, and I totally agree with that statement. If you can't stand up for your children in a country and their needs, then what do you stand for at all? And indeed, if America stands for anything at all, I believe we stand or should stand for the promise that our children will have the opportunities that we only dreamed about, that each generation will enjoy that new chance to survive. Every generation of Americans has had this ambition for itself, that when day was over, its time had passed, that the judgment would be they left their children in a world that was far better, far safer, far healthier than the one that they had assumed as adults. We're about to become the first generation of Americans that cannot make that claim in our country. And that ought to be a stark reminder to everyone in this country how important these issues are. When we fall short on these issues, when we see our children falling behind instead of moving forward, we fail in our historic obligation to live up to the most sacred principles of our country and the most sacred commitment that each generation has made to the next. All that being said, of course, there's plenty of lofty rhetoric about how we should deploy and support the mission of improving children's lives. What we're lacking, of course, despite the lofty rhetoric, is a systemic, objective, and accurate gauge of how that progress is occurring. And although there is no shortage of data regarding children's issues, we need to understand where our children are in relation to where they need to be. And that's what doesn't exist today. And that's why this commitment by First Focus and Save the Children is so unique, this commitment they've agreed to take on, to be able to make that judgment, where we ought to be and where we are. We get a lot of where we are, but not where we ought to be. And by having that data comparison, will be for the first time allowing us to make judgments about where we need to move in the areas which need improvement. When it comes to these issues, numbers are not enough, of course. We need a report card that can measure the progress of our children, measuring growth. This is one of my great complaints about Leave No Child Behind, the education proposal. Instead of measuring just children by giving them tests and exams, measuring the growth of that child is really what we ought to be doing. In a sense, this report card will give us that opportunity to measure growth in our children. And that is the conclusion of our subcommittee's work over the course of these series of hearings that I've mentioned. We've sought not only to examine the problems, but to set goals for improving conditions for children and families and measurable benchmarks. And that is why we invited you here today to be a part of this announcement, announcing the result of our work, report on the status of the American child, and announcing a partnership of First Focus and Save the Children, and that will continue to work and issue this report card on an annual basis going forward. And as our hearings found, there's much work to be done, and these organizations know it as well as anyone in our country, if not more so. Our subcommittee found that family economic insecurity has an overwhelming negative effect on every aspect of a child's life. When a child grows up in a family that must constantly worry about the floor falling out beneath their feet, that child is denied a chance to maximize their potential. Children who grow up in poverty, even those who only experience it for short periods of time, it need not be a long period of time to experience poverty, are more likely to drop out of high school, more likely to commit crimes, more likely to fall into poor health later in life, and of course they face significant reduced income potential. Sadly, the problem is getting worse. Costs for the essentials of a stable upbringing, food, shelter, health care, child care, are skyrocketing in our country, and families are being forced to do more with less. Family income has declined, despite the fact we've had relatively low inflation, almost none at all, over the last number of years. In the midst of all of that, these families are falling further and further behind. One study that just came out recently has indicated that a two-income earner family today has less discretionary income that was available to a one-income earner family just less than a generation ago. And today, of course, more and more families are two-income earners when they can be, but they're falling behind. With the economy still in recovery, we run the risk, obviously, of losing a generation of American children to the plague of economic insecurity. Brookings Institution study estimates that child poverty rates may increase by as much as 25% in the next few years in the absence of stepping up and recognizing what needs to be done. Now, again, I have faith that our country will eventually regain its economic footing, as I believe all of you do as well, but we must continue to treat family economic security as vital, child poverty as unacceptable, and statistics like the ones I've recited to you as critical in evaluating whether we're meeting the needs of 1 in 4 Americans. Similarly, our subcommittee found serious shortcomings in our education system, and even though we know that early childhood education, the cause that Bob Casey has, in his 4 years, has just spoken eloquently about on time and time after, on every occasion, is critical to preparing children for a full achievement. 40%, I hate to even say this, 40% of American children ages 3 to 5 don't go to nursery school, preschool, or kindergarten. 40%. As a father of a 5-year-old and a 9-year-old that go to a preschool and kindergarten, the value of that child, my children, getting ready to learn when they start out in schools, in public schools here in Washington, D.C., is just invaluable. The fact that 40% of children my daughter Christina's age are not in that early education program, preparing them for lifelong learning, leaves that child already behind before they start. And if you're behind before you start, in many cases, you never, ever catch up. Never. So it isn't just a question of sort of filling it in quickly here. Those children already are going to be living a life that has less fulfilling potential than it would be if they were able to start out earlier in life. At every level, elementary, high school, and college, Americans are falling behind. Here we are again, the greatest country on the face of the earth, wealthiest. There are 17 other developed countries in the world that have lower dropout rates than the United States. We rank 18th out of the 24 major industrialized nations in the world. Only a generation ago, we were number 1 in the world in terms of achieving the ability of making it possible for children to move on to finish their high school educations. African American, Latino students continue to languish in the achievement gap. And even those who do graduate from high school are finding, of course, the skyrocketing cost of a higher education beyond not only their reach, but even their imagination, given the costs that have so increased over the years. Our subcommittee found better news in our examination of children's health. We reduced environmental hazards like lead poisoning and tainted drinking water. Our children have better dental health than they did a generation ago, and more are covered by basic health insurance. But the obesity crisis that I mentioned a moment ago represents a new and growing threat. The number of children classified as obese has tripled since the 1970s. These children are at greater risk for developing life-altering conditions, including diabetes, heart disease, arthritis, asthma, and cancer. And the cost of our nation for the health of these conditions will require over the course of their lives is in the billions and billions of dollars. In addition to looking at the problems, our subcommittee looked into the federal government's response, and we identified initiatives that do make a difference. Again, programs like Head Start, the Earned Income and Child Tax Credits, greatly helpful. What a difference they made. The WIC program, Women, Infant, and Children program, child care, development block grants, which I mentioned earlier that Orrin Hatch and I started and that Bob Casey is championing as well. A children's health insurance program that Ted Kennedy was such a champion of, and Hillary Clinton, predating our efforts on national health insurance, and the Family and Medical Leave Act that I mentioned that I drafted and President Clinton signed into law in 1993. 100 million people in this country have taken advantage of the Family and Medical Leave Act since February of 1993. So looking forward, we must continue to act to alleviate the burden the recession is placing on their lives. And our subcommittee report calls for reauthorizing key portions of the Recovery Act, including the enhancements made by the Child and Income Tax Credits, making work pay tax credits, and the emergency unemployment benefits. And even as Congress turns towards balancing the budget and all the news the last 2 days, this panel that's come out with their recommendations, we urge it not to do it on the backs of children, to not be so foolish in the sharp pencils, and those shadowy visors that people that wear that crush all the numbers here. In crushing them, be careful you don't crush the very children who will be asked to assume the responsibility of taking this country to the rest of this century. And my great fear is that we'll only look at numbers here and not understand the effect of what we're doing. We proved as a result of what the Clinton administration did by talking about earned income tax credits and those investments, we turned around numbers. We've been able to demonstrate that these programs that I've identified actually work in reversing trends. And so the empirical evidence is there about what happens when you make the investments. And I would clearly point out that the evidence is going to be there that if you don't make these investments, what you can anticipate the results to be. As much as we all want to see progress, obviously we can't assume that these proposals or that these efforts are going to be respected when these debates occur. That'll require people here, people like those of you in the audience and others, to make the case. This ought not to be a partisan divide. I've yet to hear a Republican, Democrat, conservative, liberal argue with the notion that each generation bears the responsibility to make intelligent investments in the lives and well-being of our children. That's one subject matter that ought to bring all of us together. Now, we can debate about how to do this, and I understand that's legitimate. But you don't walk away from it, not just with the lofty expressions and speeches. You've got to make the choices. We've got to fight to keep children not only in the forefront of our hopes, but also in the forefront of this debate that'll be coming up. I won't be here. You will be. Bob will be here and others to make the case. I'll do what I can on the outside, in the bleachers, to be heard. But I'm counting on those of you in the room here today and others to make the case to insist that these issues are not left to the back burner. One way we can do that is by enacting what I mentioned earlier, the National Council on Children, that Bob Casey and I authored a few weeks ago, and it will require some support, but we've demonstrated in other states where this has happened, it makes a difference. The Council would be responsible for annual assessing the state of American children's health, their education, their overall well-being. It will be tasked with making recommendations to the Congress, much as the report card would. So you've got annually, much as we do with Humphrey Hawkins on unemployment that goes back. It'll be built into the system so that we'll be getting that information on an annual basis, because these two organizations have agreed to take on this incredible responsibility of helping define where we are and where we ought to be. And I can't begin by thanking you enough for doing that. So I appreciate your patience in listening to me here for a little longer than I normally would do in a situation like this with some very terrific people behind me. But I do get passionate about this. I mean, It's hard to get passionate about derivatives, but I can get passionate about these issues here. And this to me was the most important part of my work for 3 decades in the Senate. And to have someone like Bob Casey and others, certainly great champions already, and Barbara Mikulski, Patty Murray. I mean, there's a long list of people in our committees. Ted Kennedy, of course, was the champion of champions on these issues during his entire 4 decades, more than 4 decades of service here. So I'm going to turn to Bob and then Bruce and Mark to share some thoughts with you as well. But Bob, I can't tell you the sense of relief knowing that you're going to be there and carrying on these battles.